Tell us about some of the advances that have taken place in dental implants and what they are and how they work.
Okay, so dental implants, pretty much if you lose a tooth, you can place another tooth into the extraction site, or sometimes you would need to place a bone graft into the site and then put an implant in at a later time. Some patients, if all of their teeth have gone bad and they just want a new set of teeth, we can extract all their teeth and place multiple implants and give them a whole set of teeth right on top of the implants.
So, what types of problems can dental implants address?
Typically, we recommend that you replace the missing tooth with a dental implant because if you don't, over time, you can end up losing the bone support. Your other remaining teeth will migrate into the area, so we really recommend having a replacement of that tooth soon after the tooth is extracted, just to avoid gum disease and other teeth migrating in, crowding, and just collapsing of the bite altogether.
So, what's the process that a patient would go through if they wanted to get dental implants?
Typically, the implant placement is done on the day of the extraction, if possible. If the site is not suitable for the implant to be placed on that day, we would place bone graft, and the patient will come back about 3 to 6 months later to have the implant placed. It's a very simple procedure where the implant is placed in, and the patient is sent off either with a healing abutment, which is a little cap on top of the implant, or they leave and the implant is buried and submerged below the gum for 6 months. 3 to 6 months, and sometimes they can have a tooth placed on there as soon as 3 months from the time the implant's placed. In other areas of mouth where the bone quality is not as good, it would take up to 6 months for the implant to be suitable for a tooth to be put on there.
What kind of results can patients expect to get when they get dental implants?
The results for a dental implant is just amazing. How we can now have teeth where we're missing teeth in the past and not able to have function and aesthetics.
That's wonderful. I mean, it seems like there's been so many advances, and the dental implant placement and process has come a long way over the years.
Yes, it's much simpler. Sometimes patients have very little pain. I call patients after any dental implant procedure, and they usually tell me don't feel anything. They don't have any pain or discomfort, no swelling. It's less uncomfortable, I guess, or less complication than even an extraction. So.
And how long do these dental implants typically last, Dr. Ortega?
So the implants, usually we would know whether or not the implant integrates with bone, and the success once it integrates with the bone, the success of the implant pretty much will last your lifetime, as long as you clean and brush your teeth and floss and maintain the way you would your normal teeth.
That seems like a no-brainer. It's basically like you've gotten your tooth back or your teeth back that you were missing to get you back to eating the way you used to eat, have that great smile that you used to have. So it seems like a no-brainer.
Right.